Welcome to GMA's Affordable Care Act Training Session 2 for applicable large employers. This training session is about the pay or play penalties under the Affordable Care Act. The all-important legal disclaimer. This ACA training session is for informational purposes only, and it is not legal advice or a substitute for legal advice. It is designed only for employers that offer the health plan administered by the Georgia Municipal Association on behalf of the Georgia Municipal Employees Benefit System, and it contains information that is not applicable to other employers. This ACA training session reflects the presenter's understanding of certain requirements of the ACA as they existed on April 22, 2015. While this training session describes certain eligibility provisions of the health plan, it is not an official document of the health plan. Only the official health plan documents establish the terms of the health plan. GMA offers 4 Affordable Care Act training sessions. Session 1, Waiting Period Rules and How to Determine Applicable Large Employer Status, is very important for all employers of any size who are offering the GMEBS coverage to review. Session 2, the Pay or Play Penalty Rules, is this session. It is for applicable large employers only. Session 3, the Minimum Essential Coverage Reporting Rules, 6055 reporting on the 1094 and 1095B forms, is appropriate for all small employers who are not ALEs to review. Finally, Session 4, the Pay or Play Penalty and Minimum Essential Coverage Reporting Requirements, 6056 reporting on the 1094 and 1095C forms, is for ALEs only. All training sessions are posted on our website, www.gmanet.com, under Services, Life and Health, More Info.
A quick recap of Session 1. Employers may not have a waiting period longer than 60 days to get into the GMEBS health plan. Employers must offer coverage to anyone who is eligible as a GMEBS regular employee. So that's one important thing that some people have noticed that really has nothing to do with ACA is just checking personnel policies and making sure that you are actually offering coverage to those who qualify as stated on your declaration page. And applicable large employers may offer coverage to ACA mandate employees in 2015 in order to avoid ACA penalties. We also provided step-by-step instructions on determining whether the city is an applicable large employer. So, big picture.
Yeah, the big picture of the Affordable Care Act, we covered a little bit of that in Session 1, if you were able to participate this Tuesday or even last Tuesday, in terms of the broad idea of the Affordable Care Act. Today we're going to talk about some of the what the Act calls employer shared responsibility arrangements, which we call penalties. These are based on a couple of obligations that large employers have, which you see in the second and third bullet points there. The first being to offer affordable minimum value health coverage, and we'll talk about what those terms mean, because what constitutes affordable and what is minimum value is unique as defined under ACA, and we'll talk about those terms. And that coverage must be offered to substantially all ACA full-time employees and their dependent children. And if not, that's what would trigger penalties. And then in that last bullet point, we talk about filing reports with the IRS and to employees about the coverage that's offered, both in terms of scope and the timing and all of that kind of information. And we'll talk about that because those are some of the things that employers have to do, large employers have to do to comply with ACA.
A quick overview of Sessions 2 and 4. In this Session 2, we focus only on penalties related to health coverage called the pay or play penalties. Applicable large employers are subject to pay or play penalties, and penalties can be large. This training session reviews how to ensure that your employer is not subject to these pay or play penalties. In Session 4, we discuss the reporting obligations. All ALEs have to file Section 6056 reports, and these are really self-reports to the IRS of whether pay or play penalties are required. There are penalties for not filing, and there are a lot of rules about how to complete these forms. It's very important for all ALEs to look at Session 4, which describes the reporting requirements and instructions based on the final IRS forms. Okay, let's start looking at pay or play penalties.
So what triggers a pay or play penalty? Well, there are two different types of penalties, and we'll talk about those in a minute. But for either one to apply, all three pictures on this slide must apply. At the bottom left, you see our employee there pulling or clocking in at the time clock. It has to be a full-time employee, somebody who works 30 or more hours each week is a full-time employee as defined by ACA. So that's the first picture. The second picture there in the middle, you'll see the person, walking away with a shopping cart and health care in that. The full-time employee has to buy insurance on the exchange, not use the employer's coverage, but go out and buy it on one of the government exchanges. That's the second requirement. And then the third requirement is that full-time employee who has bought insurance on the exchange has to qualify for and get a government subsidy to help pay for the insurance bought on the exchange. So all three of those things have to apply, and we'll talk about some of the eligibility criteria for getting the subsidy. Now, the first two things might be pretty easy, but financially, and in terms of your income, there's only a narrower group that can qualify actually for the subsidy based on household income. Before we get into some of those details, we thought it was a good idea just to point out a few things of what would not trigger a pay or play penalty, because I think that helps prepare your thinking for the folks that could trigger a penalty. Those who have household income of greater than 4 times the federal poverty line cannot trigger a penalty. Again, this is a little bit of a fluctuating level there, but depending on whether you're individual or family. But the important thing to remember is that only those who are in the lower income brackets are able to qualify for a subsidy. The second bullet point, if they're offered enrollment in an employer-sponsored plan that does provide minimum value and that is affordable, then they're not going to be able to trigger a penalty because they've been offered appropriate coverage under ACA. So even if they opt out of that and go to the exchange, they're not going to be able to trigger a penalty because they were offered appropriate coverage. And the third bullet point, if they actually enroll in the employer-sponsored plan, that means they don't satisfy the middle picture in the previous slide of having gone onto the exchange to buy their coverage, so they can't trigger a penalty. And then that last bullet point, if they participate in some other type of government-sponsored health insurance, they also can't trigger a penalty. So I think most people are familiar with Medicare and Medicaid. CHIP is the Children's Health Insurance Program that is available for, again, lower income bracket children under 18, and TRICARE is military coverage. So if somebody participates in those coverages, they would not be able to trigger an employer penalty under ACA. So now distinguishing the types of penalties that exist, we're going to talk about these, but we wanted to just depict them visually first. The first is the no offer of coverage, or what's called the sledgehammer penalty, and that can be really big. So if one person gets coverage on the exchange and a subsidy, that one person can trigger a huge penalty for you. That's why we have this very scary-looking muscular man with the sledgehammer there on the left. The other penalty, though, is much more discreet. It's what some people call the crummy coverage or the tack hammer penalty, and that's if you offer otherwise fine coverage, but it's not affordable, or it might not encompass all of the things it's supposed to cover, therefore the crummy coverage possible title to it. There's a $3,000 penalty, but that only applies to those employees who actually get the subsidy. That penalty does not trigger kind of the broader application of a penalty to all of your employees like the sledgehammer penalty does. So that's just a visual depiction of the impact of these two penalties. So The sledgehammer penalty is something, just in summary, where if you're a large employer and you don't offer minimum essential health coverage to substantially all full-time employees and their dependent children, and at least one full-time employee triggers the penalty by getting a subsidy, then the sledgehammer penalty applies. Substantially all we've put up there, and I guess I want to talk about several of these underlying terms. The penalty applies if you don't offer this appropriate coverage. Allison has told me that there have been some questions about, does this mean we have to pay the full cost of the employee's coverage? And the answer is no. You just have to offer it. The affordability of it is something that we'll address when we talk about affordability, but the obligation to offer coverage is merely to make it available, not necessarily to pay for it. And again, there is a limitation on that, and we'll talk about that when we talk about affordability. The next underlying term or terms is substantially all full-time employees. What the statute says, looking at the bottom section there in the red numbers, the statute says, and the initial guidance says, you've got to offer coverage to 95% of full-time employees. But as transition assistance for 2015, that number is only 70% of full-time employees. The reason for that, as we touched on a little bit in session 1, is that who is an employee encompasses the concept of a common law employee, and that's broader than who you might think of as your employees. And so this 70% substantially all definition for 2015, I think, is designed so that employers can come to grips with the realization of who will be deemed a common law employee for purposes of defining the group of full-time employees under ACA. And then in 2016 and beyond, the regular 95% coverage rule is going to go into effect, but you will have had a year of experience figuring out who is an employee for ACA purposes.
So a word about the GMED's health plan. All GMED's health plan coverage options are minimum essential coverage. In fact, really, most employer-sponsored coverage will meet this kind of broad definition of minimum essential coverage. All employers are able to offer coverage to dependent children by selecting employee plus child or family or both on their declaration page. And all employers may offer coverage to individuals they determine to be ACA full-time employees. So exposure to this penalty, this sledgehammer penalty, is based solely on the employer's actions. It's not anything we can control here as a program administrator. So the no offer of coverage sledgehammer, this is the basic rule. The penalty amount for the month is the number of full-time employees in that month, minus 30, times 1/12 of 2,000. That's how you figure out what your monthly penalty will be. If somebody triggers that coverage, it's going to be the number of full-time employees minus 30 times 1/12 of 2,000. For 2015 only, instead of subtracting 30, if you have 100 or more full-time employees, you can reduce it by 80. But if you have between 50 and 99 full-time employees and full-time equivalents, you can only reduce it by 30. And we'll see how that works in just a second. So here is Happy City. Happy City employs 150 ACA full-time employees, but it does not offer coverage to at least 70% of them. So it doesn't meet that minimum criteria. So at least one of those ACA full-time employees triggers the penalty for every month. If this happens in 2015, the penalty would be $140,000. And you can see the math directly to the right. How did we get to $140,000? Well, we know that somebody triggered it for every month, and they didn't meet that category for every month. So we're really just going to look at the full year. So you take $2,000 times 70 full-time employees. How did we get to 70? 150 full-time employees minus 80, because Happy City has more than 100. If this happens in 2016, the penalty would be $240,000. How did we get to that? 2,000 times 120 full-time employees. We got to 120 by subtracting 30 from the total number of full-time employees. So that's the consequence you can have if you don't offer coverage to at least 70% of your ACA full-time employees. Well, let's say that you offer coverage to enough people to so that the sledgehammer penalty does not apply. Well, you can still be subject to this crummy coverage tackhammer penalty. And I use the term crummy coverage because, I think if you offer me a really great health plan, but it costs so much there's no way I can afford it, that's crummy to me. That's why I use that term. So there are two types of triggers for this tackhammer penalty. The employer might pay the tackhammer penalty if an ACA full-time employee gets the federal subsidy because he or she wasn't offered the coverage at all. So let's say part of that the 30% that didn't get any offer of coverage, although the sledgehammer doesn't apply, they could still trigger this tackhammer penalty. Or that person was offered coverage, but they didn't choose it. And the reason they didn't choose it was because it wasn't affordable or it did not provide minimum value. Well, all GMEB's health plan options provide minimum value. So the only exposure, the penalty exposure, depends on whether the employer fails to offer the coverage or fails to make the coverage affordable. And again, those are two things that are entirely within the employer's control: who you offer coverage to and how much you subsidize it. For the tackhammer penalty, for that month, it's the number of full-time employees in the month who actually got the federal subsidy times 1/12 of 3,000. And you'll never pay more than you would have had to pay if the sledgehammer rule applied. So let's talk about Risky City. So Risky City just really wants to cut it right on the line. So they offer coverage to exactly 70% of the 150 ACA full-time employees and their dependent children. So because of that transition relief, there's the sledgehammer penalty does not apply. But what if 20 of those ACA full-time employees go out and buy on the exchange and get a subsidy? Well, Risky City will have to pay a penalty of $60,000. 60,000 is 3,000 times 20, the number who actually got the subsidy. So, if you're thinking, oh, we just have to, only 70%, that's not so bad, we can continue excluding a bunch of people, realize that you could actually have to pay this tackhammer penalty, which can really add up. So here's an example. Central City, this is an example of how it could be triggered when it's not affordable. Central City offers coverage to 100% of its 150 ACA full-time employees and dependent children, so the sledgehammer penalty does not apply. 2 of the ACA full-time employees get a federal subsidy in each month because the coverage did not meet an affordability requirement. In that case, it's 3,000 times 2, a $6,000 penalty. Where'd it go? I can't see my little, there we go, thank you. So a quick comparison of the two penalties. The sledgehammer penalty is number of full-time employees minus 30 times 1/12 of 2,000, reduced by 80 for 2015 only for large 100 ALEs with 100 or more employees, full-time employees. And then the tackhammer is the number of full-time employees who actually got the subsidy times 1/12 of 3,000 per month. So who is an ACA full-time employee to whom affordable minimum value health coverage must be offered in order to avoid penalties?
And for that, we're going to go to this next slide as soon as I find the cursor. There it is. And look, we're going to look in the next several slides at these defined terms within ACA. Because full-time employee, a lot of times we think of a full-time employee as somebody who's working 40 hours. And sometimes for benefit plan purposes, you might define full-time as working 35 or 32 hours. Now, and some employers used to have something like 25, but if you're a large employer, at least for health coverage, you've got to define that as at least 30 hours a week. Again, we're going to be looking in this presentation only at the ACA definitions of these terms. We'll also consider what is an hour of service. That can be different under different laws, but ACA has its own concept of what an hour of service is. We're going to look at these period definitions of what they mean, and we'll cover a little bit later on minimum essential coverage, minimum value, and affordability. So an ACA full-time employee, just as kind of an overview, again, is a common law employee credited on average with 30 or more hours of service each week, or 130 hours of service per month. So it's 30 or more per week, or 130 per month. And if you can think in the second bullet point, you count the hours during a measurement period to determine whether a worker must be classified as full-time for a future stability period. So if you think visually, and we don't have this on here, we've got some examples in later slides. If you think of a timeline, there's a measurement period. It might be 6 months, it might be 12 months, whatever, but during that measurement period, you're measuring whether somebody works 30 or more hours each week. If that person has worked 30 or more hours each week during the measurement period, they're entitled to be offered coverage throughout a stability period. And if their hours during the stability period dip below 30 a week, it doesn't matter, because the idea of the stability period is that their coverage, their availability of coverage is stable based on the previous measurement period. So we're going to talk about those concepts, but just to introduce the idea, I wanted to think of a simple timeline. The measurement period determines your eligibility to be offered coverage during a stability period.
So starting January 1st, 2015, all large employers are allowed to offer coverage to individuals who don't meet the definition of a GMAB regular employee, but who do meet the definition of an ACA full-time employee. It is the employer's responsibility to identify these ACA mandate employees and offer them enrollment information. So this dinosaur egg is what it looks like to me. This at a glance shows you all the people who are allowed to be in the GMAB's health plan. The big blue circle on the left is GMAB's regular employees. These are people who have always been eligible for the GMAB's health plan, just kind of business as usual. U.S. resident in a position that requires 30 or more hours per week and is expected to last at least 48 weeks. So this, the bulk of your, this big blue circle should be very familiar to you. But there are other employees who don't meet that definition, but do meet the definition of an ACA full-time employee. Those could be people who are in 9-month positions, or as we discussed in session 1, it could be a situation where a staffing agency worker meets the definition of an ACA full-time employee. They're not allowed, they wouldn't be allowed in the plan as a regular employee, but if you determine that they are an ACA full-time employee, you could enroll them, and in fact you would have to offer them coverage in order to avoid some of these penalties. So this is an example of people who could be these mandate employees, people who are in part-time positions, clearly. Let's say you have somebody that you hired to be into a part-time position, and then it turns out later, when you actually count their hours, even though you intended them to be in a position where you weren't supposed to work more than 30 hours per week, it turns out that they actually worked more than 30 hours per week during the previous year. That would be a situation where you would offer them coverage as an ACA mandate employee. You might have some people that you classified as independent contractors for years and just issued them 1099s, Well, it turns out when you look at all the factors that we talked about in session 1, it turns out they are your common law employees, and if they're working more than 30 hours a week, you would need to offer them that coverage. There may be people who are in positions where the hours are expected to go above and below. If you determine that they are an ACA full-time employee, you would need to offer them coverage. And I already talked about staffing agency and short-term workers. So the definition of hours of service is any hour for which an employee is paid or is entitled to payment for performance of services and each hour of paid time off. For hourly employees, you need to look at the records of actual hours when you're counting up those hours during the measurement period. And for salaried employees, you use equivalency methods. And we talked about that in training session 1. A lot of salaried employees don't track their actual hours. And so there are ways where you can say, for anyone who's in this salaried position, we're going to consider them as having worked 40 hours a week. For, if they work any part of that week, we're going to count them as having worked 40 hours. And those equivalency methods are in training session 1. There are also some special rules for how you're supposed to treat unpaid FMLA and USERA leave. And also, just a reminder that all of these counting rules are based on controlled group rules. So you would have to count up people within the controlled group. A measurement period, as Patrick mentioned, is the safe harbor that lets the employer look at the hours of service during a measurement period and decide whether the employee will be treated as a full-time employee for future stability periods. It is up to the employer to determine what measurement and stability period you're going to use. And you'll need to use the same measurement and stability period for people in the same permissible category. So you can use let's say you choose a 12-month measurement period and a 12-month stability period. You could use that for hourly employees only or for salaried employees only. But you can't say, well, we're just going to use measurement periods for seasonal employees. It really has to be everybody in the same category, whether hourly or salaried or both. So here's Mary, and the question is, should she be treated as a full-time employee in 2015 for a stability period? Well, you want to look back at her hours of service in the 2014 measurement period, or in the previous year's measurement period. So the only common law employees of Healthy City who aren't GMEB's regular employees are part-time position employees and variable hour employees. So Healthy City applies measurement periods and counts hours during the measurement periods for all 40 employees that were in part-time positions with hours less than 30 hours of service. And it does the same thing for 30 employees in variable hour positions. Healthy City determines that 8 of the part-time employees and 15 of the variable hour employees are ACA full-time employees who must be offered coverage in 2015 to avoid penalties. And so Healthy City didn't really have to look too much at all the regular employees because they're already enrolled in the plan. It's trying to find its mandate employees, people who are excluded, but they really have to offer coverage to because of ACA. For ongoing employees, we use this term the standard measurement period, and you count the hours of service for the standard look-back period between 3 and 12 consecutive months, and then you treat those full-time employees as full-time employees for a stability period, at least 6 months and no shorter than the look-back period. As I said, you can use different periods for salaried and hourly, and you can change the length of the period from year to year, but not in the middle of the year. Most everybody that I've heard of is using a 12-month look-back period and a 12-month stability period because it is easiest to administer. So for the standard measurement period, let's say you choose this period from September 30th of 2013 to October 1st of 2014. That's going to be your 12-month period, and you look at the hours during that period to see who qualifies as an ACA full-time employee. Then, during annual enrollment for GMEBs, which is usually the month of October, you're going to provide enrollment information to everyone who meets that definition of an ACA full-time employee. And of course, if you've elected members of the governing authority, they would get the enrollment information too. Everyone who came in as an ACA full-time employee, who qualified as an ACA full-time employee for the look-back period, they will not lose their eligibility if their position changes to require less than 30 hours of service during the stability period. They are basically protected, locked into that coverage. The only thing that would cause them to lose it is if they terminate employment. Patrick, would you please describe how these measurement periods overlap from year to year?
Sure. You'll see at the top of the slide we've got standard measurement period 1, and to the right of that, sorry about that. In the top you've got standard measurement period 1, and to the right of it, stability period 1. And as I explained in an earlier slide, the measurement period determines your eligibility to be offered coverage in a stability period. But notice the dates in measurement period 1 and stability period 1. Below that, we've got a different timeline. Part of stability period 1 is also part of a new measurement period 2 for a future stability period. And so the example I gave before, let's say in measurement period 1, you average 30 or more hours a week, you are entitled to be offered coverage throughout stability period 1. But what if your hours dip below an average of 30 hours a week in that stability period 1? Doesn't matter, because in measurement period 1, you had enough hours to be a full-time employee. You're entitled to that stability throughout the stability period of having coverage offered to you, even though your hours dip. But you'll notice that the stability period is January through December of 2015, and much of that same time period is what is now part of standard measurement period 2. And so because your average hours dip below 30 during that measurement period, you might not be entitled to offer of health coverage during stability period 2 in 2016. So even though you're stable during stability period 1, even though your hours dip below, the fact that your hours dip below may affect your eligibility for coverage in a future stability period.
Thanks. So we talked about the standard measurement period, which is used for ongoing employees, but there's also something called the initial measurement period for some new employees. So these are the different types of new employees you can have. There are non-variable employees, and these are employees that you reasonably expect to work 30 or more hours of service per week. This matches up nicely with the GMEB's regular employee definition, because the GMEB's regular definition is, are they in a position where it's expected that they will work 30 hours or more service per week? For GMEBs, you have to offer them coverage as long as you expect them to work for 48 weeks. Then there's a variable employee where you can't reasonably determine whether the person will work above or below 30 hours per week. And then seasonal employees, when you're hiring somebody who's going to work for 6 months or less at the same season each year. And then part-time employees, where you reasonably expect them to work less than 30 hours of service per week. And I've put a little asterisk next to those employees that would not be considered GMEB's regular employees. These are people who you would not normally offer them coverage: variable, seasonal, and part-time. So for non-variable new employees, they're clearly ACA full-time employees, so there's no initial measurement period. You just have to go ahead and follow the waiting period rules in the declaration page, and almost all of them will be GMEB's regular employees. So when you're wondering, is this a non-variable new employee? Well, you might want to look at the job description. What does the job description say or other documents say about hours of service? How is the position advertised? Is this person replacing somebody who always works 30 hours of service or more? Those are some indications that this person also is reasonably expected to work 30 or more hours of service. So when you have this a person who's a new seasonal variable hour or part-time employee, they are allowed to have this initial measurement period where there's no penalty if you fail to offer them coverage. This initial measurement period, as I said before, most likely it's going to be 12 months. It begins on any date between the start date and the first day of the following month. You can have this optional administrative period, and then the stability period is the same length as the stability period for ongoing employees. It'll be easier to understand this when we do the example. You'll see how you have to measure these folks twice. First, when they're hired, you give them this initial measurement period, and then the next time a standard measurement period comes around, you measure them again. So here's Bob, who looks kind of sad. He starts a job on May 10th, 2015, and the position documents or the job description says, Bob, your hours are expected to vary above and below 30 hours of service per week. He's not a GMEDS regular employee, because to be a GMEDS regular employee, you have to be in a position where it's expected that you work 30 hours of service or more per week, and not vary up and down. So Bob's coverage starts over a year later, on July 1st, 2016. Well, how does that happen? Well, first, Bob is hired and then has this initial, is that the laser pointer? So Bob is hired up here in May 10th, 2015 to May 9th, 2016. That's the period of time where you're going to count his hours and say, yeah, he went above and below, but did he actually average 30 hours or more? Well, it turns out he did. He averaged 30 or more hours of service during this measurement period, during this initial measurement period. And so he is eligible to enroll for coverage starting July 1st, and he gets this stability period, July 1st to June 30th, where you can't take that coverage away from him unless he terminates employment. Then, in the middle of that time, you look at his hours again using the same measurement period you use for all the ongoing. Turns out he averaged 30 or more hours of service during that measurement period. So his stability period is extended to 12/31/2017, and he starts being on the same cycle as everyone else. But this is a situation where he does not have to have coverage until it's actually determined that he worked those hours. Here's an example for a seasonal employee. Jeff starts a job as a lifeguard on May 10th, 2015, and the position says it will require 32 hours of service per week and will last throughout the summer season until August 15th. Jeff is not offered coverage. Well, it turns out that during this period, he did not average 30 or more hours of service. So he's not a full-time employee, and there are no penalties for failure to offer him coverage. So, as you may recall from session 1, we have this waiting period rule that says that you have to enroll people within 60 days. Well, we have this guidance that says you don't violate the waiting period rules if you are following, if the employee is within the initial measurement period. You just have to make sure that they are enrolled within 90 days of the end of the initial measurement period, but no later than 13 months of the date of hire plus the rest of the calendar month. Keep in mind there's some special rules for these measurement periods. You're allowed to work with payroll periods instead of months and weeks. There's some situations that arise if you switch from a variable employee to a non-variable in the middle of the year. And there are some other special rules that Patrick will discuss.
I think the important point, I'm just going to turn off the laser pointer here, is that the right spot?
Yep.
I think the important point on this slide is that these rules apply if there's a change in someone's circumstances. The slide that Allison has just reviewed about new employees and an initial measurement period, and also for ongoing employees, a standard measurement period. Here, this slide talks about if you're in an initial measurement period, but something changes, like the second bullet point, variable, seasonal, part-time employees change to a non-variable position, okay, that's going to change their initial measurement period and may even obviate, under the GMEDS plan, having an initial measurement period because they would be entitled to coverage within the waiting period. Also, there's special rules about counting hours of service during what the regs call special unpaid leave, which encompasses FMLA, USERA, and jury duty. So again, if you have a circumstance where somebody is in an initial measurement period and one of these kinds of leaves applies, let us know, because these are these are things that have special rules and may need a little bit of tweaks. And again, we've got special rules for change from hourly to salaried, may cause a change in the measurement method. As Allison pointed out, there's you can have different measurement periods and stability periods for hourly versus salaried, so that can change what's going to go on. Continuing with our look at the definitions used in ACA, we've got minimum essential coverage and minimum value. Again, to avoid the penalties, an employer must offer minimum essential coverage in the plan that provides minimum value to the requisite number of full-time employees, whether it's 95% generally, or for 2015, 70%. Just to let you know what GMEDS has done for you, minimum essential coverage contemplates the health care services that have to be offered in the plan. So there are certain prenatal things, there's certain mental health things, and those sorts of things that have to be part of the bundle of benefits offered. That's what minimum essential coverage refers to. Minimum value is an actuarial assessment that 60% of the anticipated cost would be covered by the employer of the plan. Again, what the main point on this slide is that GMEDS has taken care of that for you. So the GMEDS health plan are all minimum essential coverage, and they provide minimum value. So you're set there.
Now let's talk about the term affordable. This is a term defined by the ACA, and it doesn't mean exactly what people think it means. To avoid pay or play penalties, an employer must offer minimum essential, minimum value coverage that is affordable. And for the ACA, that is based on the cost of employee-only coverage for the cheapest option offered. So that means that spousal coverage and family coverage can be expensive, and the coverage can still be affordable under the ACA. Employers may want to be very careful when describing their coverage as affordable to say that it meets the definition of affordability under the ACA or is ACA compliant, rather than telling people that it is affordable. Starting in 2015, in order to be affordable, the month's coverage for employee-only coverage for the cheapest option available can't be more than 9.56% of household income. But there are three safe harbors because it's very hard to tell what the true household income is for each employee. So employers can use these three safe harbors: the federal poverty line, rate of pay, and Form W-2 safe harbors. When choosing what kind of affordability safe harbor to use, you are allowed to use different methods for salaried employees, hourly employees, and other reasonable business categories. This slide shows the difference in ease of administration of the different kinds of safe harbors. Certainly, the very easiest way to make the affordability safe harbor is to pay 100% of cost of the employee-only coverage for the cheapest option. So if it costs $0, it is certainly affordable. Next in ease is 9.56% of the federal poverty line. That just involves one calculation. You can ignore the actual wages of the individual employees. Next is the 9.56% of pay based on an assumed rate of pay. You do have to do some calculations, but no review of actual hours or wages. And lastly is the retrospective approach, which is 9.56% of W-2 income. You do have to do a calculation for each employee, and you're only sure that you made it after the end of the year because W-2 can change due to pre-tax contributions. So let's look at Joe and what the cost of his employee-only coverage would have to be in order to be affordable under the different safe harbors. So Joe makes $10 per hour, and his income at the end of the year is $17,000. Under the federal poverty line safe harbor, if employee-only coverage for the cheapest option is $92.97 or lower, it is considered affordable. Under the rate of pay safe harbor, if it is $124.28, it's considered affordable. And under the W-2 safe harbor, if it is $135.43 a month, it is affordable. So as we talked about in the training session 1, all employers are going to have to sign a new declaration page that states that large employers are allowed to enroll employees who don't meet the definition of a GMEB's regular employee, but who the employer determines to be an ACA full-time employee. The enrollment forms are going to be changed to allow employers to add coverage for employees outside the open enrollment periods because the employer has determined, using a measurement period, that the employee is an ACA full-time employee. So those are some things to expect, and those declaration pages should be out in August. I'd first like to say that the reporting is all about communicating to the employees so that they know what kind of coverage they're getting, whether it's intended to be affordable, because employees can be subject to penalties for not having minimum essential coverage, and also communicating to the IRS. I'd just like to remind everyone that the exchange notice, had to be provided to all employees by October 1st, 2013, and you're supposed to be providing this notice to every new hire within 14 days of hire. And that's for all employers that are subject to the Fair Labor Standards Act. And that notice says, here are the requirements for eligibility in the GMEB's health plan. This GMEB's health plan provides minimum essential coverage with minimum value, and we intend that it be affordable. So you may want to check and see what you're doing with the exchange notice, and that is, information about that is posted on the GMA website. I actually just went over this. There are no penalties for failure to provide or delay in providing, but I just wanted to remind everyone that we're already supposed to be communicating this.
Here are action items for applicable large employers that should have been done in 2014. If you haven't done them, it's time to go ahead and make these decisions and document them. Choose an affordability safe harbor for 2015 and set the cost of employee-only coverage for that year to meet the safe harbor. Identify all common law employees who could be ACA full-time employees. Identify GMEB's regular employees who must be offered GMEB's coverage based on position. Choose a look-back measurement period and stability period. Based on hours of service information from the look-back measurement period in 2014, identify ACA mandate employees, employees who aren't eligible as GMEB's regular employees, but who are ACA full-time employees who must be offered coverage for the 2015 stability period. Develop a strategy for offering coverage to all ACA mandate employees or otherwise avoiding penalties.
Some items to discuss with counsel. Whether or how to qualify for the one-year extension on pay or play penalties. So if you're under 100 full-time employees and full-time equivalents, you may want to try to qualify for that delay. If you're not sure about how to categorize a worker, if you're not sure about whether they would be considered working 30 hours or more. Before you make any personnel changes, so if you are trying to make any changes to work requirements or anything like that to avoid offering coverage or to avoid paying ACA penalties, we recommend that you speak with especially employment counsel, and that GRMA helpline is available for free for anyone who offers that GMA property and liability coverage. If you're not sure about how to revise your staffing agency contract to make sure that that you can't be hit with penalties for some of those staffing agency workers. I want to just remind everyone, GMA does not provide legal advice to cities, but we will prepare general information through frequently asked questions. So please do send your questions to me, and we are adding to that all the time. And we also provide information to city attorneys when requested. And as I said before, the GRMA helpline provides free legal advice for GRMA members. Now, I have a couple questions here. Yes, we will be sending a PDF of this webinar after this. And how does the affordable aspect come into play with dependent coverage? Well, it doesn't. When the ACA, under the ACA, you only look at the cost of employee-only coverage. So you could say that employee coverage is $15 a month or free, but spouse coverage is full cost, or coverage for a dependent child is full cost. Nobody ever looks at the cost of the dependent coverage when determining whether you meet an affordability requirement or affordability safe harbor. Thank you everyone for participating. We did get to all of the questions. We're running a little bit late, but thank you so much, and do feel free to send questions our way. Patrick, thank you for being here, and Corey, thanks for hosting.
Thank you.